Hi, everybody. Welcome back to another resource review. My name is Danielle. I'm the Community Connections Coordinator at Sarah Riel. And today we are here with NorWest Community Co-op with Kaylee and Brittany. Welcome, both of you.
Hello.
Hello.
You both look like you're working from home today.
Yes.
I like the contrast of the dark basement and the bright light living room.
Yes. Yes.
Well, thank you both for being here. And maybe we'll quickly just start with both of your roles at NorWest Co-op. So Brittany, why don't you go first?
Sure. I'm one of the social workers at NorWest, and I'm part of the family violence team, specifically with the Immigrant Women's Counseling Services program.
Great, thanks.
Which I'll explain more about later.
Yeah.
And hello, I'm Kaylee Vandenbogert. I'm a registered psychiatric nurse, but I'm working in a youth counselor role through the Youth Hub program with NorWest.
Excellent. Well, I'm excited to learn more about those programs, but maybe let's just start with what is NorWest Community Co-op? Because I feel like it is a very big umbrella of great services.
Yes. So I have kind of a big long answer for that, and then Kaylee, if you want to jump in at any
Sure.
point, just stop me. So NorWest Co-op Community Health is a community-based organization that focuses on cooperative health and wellness. So we have an access center in the Inkster Seven Oaks area, and then we have resource centers throughout the city. So we have a community food center, Gilbert Park Resource Center, Blake Gardens Resource Center, NorWest on Alexander, NorWest Co-op at Bluebird, and NorWest on Portage. And so NorWest Co-op Community Health really promotes people taking control of their own health and operates on the values of respect, innovation, cooperation, and inclusivity. And so we are the only healthcare cooperative in Manitoba. NorWest Co-op is committed to working with individuals who access our programs and services, our neighbors, other healthcare providers, and our partners to offer a variety of programs and services. So to break it down, the partners under the one roof, that includes WRHA, NorWest, and Department of Families. So within WRHA, there's public health, families first, community mental health, and those are area specific, so the Inkster Seven Oaks area. And then Department of Families has EIA and marketabilities, which is also area specific. And then NorWest is community development. So that's myself and Kaylee, and programs like Project Choices, Insight Mentors, counseling and support, early learning and childcare, primary care, outreach, the food center, and Youth Hub.
Yep. You nailed it. Yep.
That is a lot under one roof. Wow.
Yes.
Yes, it is.
That's incredible. So it's essentially like a one-stop shop. So you mentioned that there were some areas that are, or some programming that is area specific, and then there's other programming that is not area specific. So for the not area specific programming, that means anybody from over Winnipeg can participate?
Yes, absolutely.
Awesome. That's really, really cool. So with all of those different programs, is there a cost that's associated with them?
I don't believe so. No, it's free.
Mm-hmm.
Whoa. So all of these crazy one-stop shop programs and not a penny to be spent by the people accessing services.
Right.
Amazing. That's so incredible. Well, we're so lucky to have both of you here kind of representing two different programs. So maybe let's start with you, Kaylee. What is the Youth Hub?
That is a great question. So the Youth Hub essentially is a space where we want to promote positive social interaction for our youth. So we're open to folks that are like 12 to 29. We originally started with 14 to 24, but we just expanded because there's a need for it in the community for sure. So it's like an integrated youth service. So what we aim to do is bring multiple different programs under one roof so that youth can like seamlessly access everything without needing to wait. So for example, if someone came in to see me for counseling, And then, say it was like, I'm sexually active, I really need some birth control, I could walk that person right over to primary care to go and speak with the nurse. And then, for example, if they wanted to then look for a job, we could go and work on a resume together all within the same hour.
Wow, that's pretty amazing.
Thanks. It's pretty good, yeah. So yeah, we started in 2017. I think it was January 3rd, 2017 when we opened our doors. And it's just been steadily increasing our numbers, the folks that are coming through the door. And we just keep adding partners as we go. As we see like needs in the community or the community voices in need, then we do what we can to come together to bring that program to light. So yeah.
Amazing. So I know we've kind of talked about a lot of different areas where buildings might be. So what building is the Youth Hub located in?
Yes. So we're actually like tucked inside of the food center, the community food center. So that's 61 Tyndall Avenue. And so when you come in the door, like, well, right now with COVID, we have like a screener and stuff, but usually you would just walk in and then you would see a sign that says like Youth Hub this way. And then we're just like to the left when you come in.
Yeah, and that's like I've had a chance to actually go to that building and it is so cool in there.
Yeah.
Like you guys have such a great setup for the youth, and what you guys were talking about before, you guys have some of those navigators in that building as well, and then like the really cool setup for like the food programming and stuff too. It's such a cool building. It's so much fun in there.
Yes, it's very big and bright, and we actually also have like a garden behind the CFC or the community food center that Youth Hub also accesses. So we can run programs out there as well. Yeah.
Awesome. So there's so much for them to access. What do you find that, most youth get out of the programming from the Youth Hub?
That's a good question. I feel like it varies depending on the youth that you ask. So some folks come in straight just for counseling, and like they're like you can self-refer. There's no gatekeeper, preventing anyone from coming in our door. It's just a phone call away, truly. So for those folks, they would probably say, mental health supports and whatnot. However, it's pretty interesting and pretty beautiful that, their session will be done and then they're like, there's snacks. Oh, look at that. There's video games. So then they just sit down and make themselves at home. And then the flip side is also true, where we have folks that come in because, they want a snack, they're bored, they want to use our computers or play video games. And then as our rapport builds, they turn around and say, can I talk to you? I feel like I might be anxious. And so then they end up coming in and becoming a counseling client. So it kind of varies, and I feel like it's kind of holistic. Yeah.
Awesome. So what you guys have done is created this like safe, open, and welcoming environment where wherever somebody is at, where they feel good just coming and hanging out, and their needs, regardless of what those are being met.
Yes.
Amazing.
Yes, that's what we aim to do 100%. Yeah.
I love that. That is so cool. Thank you so much for sharing all of that, Kaylee. One last question about the Youth Hub. So is that one of the programs that anybody from Winnipeg can participate in?
Absolutely. Yes. We actually even have folks from outside of Winnipeg. Like I have some counseling clients from like St. Laurent and Oakbank. And our counseling is also like, it's not only in person, it's like over the phone or Zoom. So we're quite accessible, and we're also evenings and weekends. So that makes it even better, I think. Yeah.
Awesome. Well, thank you so much, Kaylee. So shifting gears a little bit then with you, Brittany. So you were mentioning that you're part of the family violence program. So what exactly does that mean?
So the family violence team at NorWest is made up of a few different programs. So there's women's relationship counseling, and that's one counselor who sees women who've been in abusive relationships or who have had trauma from those relationships or are currently in an abusive relationship. And so she'll see women or anyone who identifies as a woman and do ongoing individual counseling. And then we have Immigrant Women's Counseling Services, and that's my program. And there's 3 of us, and we see anyone who's maybe a newcomer or immigrant background, as well as non-immigrant women. for the same thing. So anyone with family violence related trauma or currently in a family violence situation, maybe past, but we deal with those types of situations too to start. Or anyone who's also had trauma from immigrating or coming to Canada. And then there's also a woman's place, domestic violence support and legal services. So that's the main office downtown. And we have a social worker, a counselor for that program, as well as 2 support workers and a family law lawyer who provides legal consults.
Oh, wow.
So, yes, there's a lot of people on our team, and we try to do the same thing, like meet clients where they're at and kind of assess like, okay, what are you coming to us with, and what's like the most pressing concern. So whether that's starting with just say the practical support with a support worker, like they need help, you know, finding a place to live, or getting connected to resources, or even just food. We have a partnership with Winnipeg Harvest, so we get some food every couple of weeks, and that's to give to our clients. And same with the lawyer, so we can provide internal referrals to the lawyer and just get them connected with any legal questions that they have. And then if that turns into a counseling client after that, then great. But we have ongoing counseling, and then since everything's kind of switched over to Zoom, we do groups over Zoom lately these days. So things like cognitive behavior therapy with mindfulness or healthy relationships. They're just offered based on who's running it. And that is kind of like a brief overview of the family violence team.
Yeah, that sounds incredible.
We also do have a children's therapist as well on our team. I just wanted to mention.
So really what you guys are doing is you're essentially, you can walk step by step with people as they're sort of exploring these new waters that are really intimidating, especially like having to talk with like a lawyer or those emergency services you were talking about, like how do I find a new place and how do I get connected to food or support for my kids, I think is a huge one.
Exactly.
For sure. So you guys are kind of available for each step of somebody's journey through that recovery.
Right. And even if, especially now, we have kind of a text line. So 9 to 5, someone can text to access our chat support. Say if they're currently in an abusive relationship, then we have our services available to them too, non-judgmental and completely supportive of what the client's choice is. So whether that's just needing some coping skills to help stay in the relationship for now, or just even figuring out like, is this an abusive relationship? So just helping them with that too. So never deciding for them, or I know some people find it quite hard to reach out to for support. So just making sure we're that non-judgmental first stop just to make things easy. And because we have such a large team too, we're lucky that we don't often have a big wait either.
Amazing. Wow. What like great work you are all doing at NorWest Co-op. Like absolutely fantastic. I love that. So Brittany, your program as well, open to all of Winnipeg?
Yes, and I also, same thing as Kaylee, sometimes meet with people over the phone who don't live in Winnipeg. So our program is open to people throughout the province, especially if it is someone seeking a legal consult too. They can know that they can call in, and that's just how they can get connected. They can self-refer by calling our main line or using the text support line, which I can give you kind of at the end if you like, or I told you the link for the website too if you want to add that up there.
Absolutely. No, that leads into kind of my next question. We're going to make sure we put all of like the contact information in the description below the video for everybody so that they have access to the website and all of that kind of stuff. So we've talked a little bit about how people get connected. So is that kind of the same for all programs? You can literally just call that program number and you're on your way?
Yeah, I would say so. NorWest Co-op Community Health has a main line for the Inkster site. So someone living in that area, I don't know if you can hear the background noise there, but someone living in that area can call and get connected with at the front desk to kind of see what fits for them. And then if anyone was wondering about the family violence programs, they can call our line, or we've even had people call on behalf of other people and then kind of figure it out that way, or even just to get information. That's all you, that's all you want at that first phone call, that's fine too.
Amazing. That's really great. So what then can people expect from getting connected with NorWest Community Co-op?
Do you want to take that?
Sure, no problem. So people can expect from getting connected with NorWest Co-op Community Health, just responsiveness, I think, and really someone returning the call and really helping in terms of, you know, what is your presenting issue? What do you need to help with getting connected? And also we know our programs and services a lot better. And even though the website is very clear, it can be overwhelming with just the different options. So speaking to one point person could just help you realize, oh, there's, you know, a Hands Kai group I can get connected to, or I want to learn about risky drinking and safe sex. So there's a Project Choices counselor, or you know, an Insight mentor if you're pregnant or have a newborn and struggling with substance use. So there's just so many different things, and it can be as simple as, you know, like Kaylee said, just going into the community food center and realizing, oh, I can go here for a meal and then talk to someone over here and then get connected with a nurse here. So I think you can just expect that you would be well connected, and even if you don't fit the requirements for one program, I'm sure that whoever you talk to would be happy to kind of find something else for you that fits, whether it's with us or with another program or service outside of NorWest even.
Amazing. That's so great. Thank you so much, both of you, for all of the great information and for all of the great work that NorWest Community Co-op is doing. That's so awesome to see you guys so actively engaged. I love it. Before I let you both go, I do have a final question for each of you. It's my favorite question to ask people. What would you say is your favorite? I see you're both working from home, but whether it's from home or from your regular office, what is your favorite office item or knickknack?
I think for myself, it might sound kind of silly, but it's having like a shawl that I can curl up and get warm and cozy into. So I would like hanging on the back of my chair. And I also have a pair of slippers.
So we're getting real cozy in your office, Kaylee.
Really cozy. Yes, yes.
I love that.
My favorite office knickknack, I kind of switch around. So Access or downtown, and now at home a little bit. My favorite thing would be, I think, just my like coffee mug. Is that weird? But I need it.
I think a lot of people probably agree with you.
Like people to have, and just kind of sets up my day. And I think that I'm going to take Kaylee's answer and start bringing kind of like a shawl sweater with me downtown for those cooler days.
Absolutely.
That's excellent. Well, thank you both so much for being here and for sharing all that great information about NorWest Community Co-op. So like I said, we'll make sure we put all of the contact information and the connecting information in the description below. And take care, everybody. Bye.
Thank you.
Bye. Bye.